Hi there, I'm Bhavik. I'm a GPST 2 in North London, in Waltham Cross, and working in a general practice rotation at the moment. It's coming up to 2 months now in general practice. I did a general practice rotation in FY2 as well, but it was very different in FY2. It was during the second peak of COVID, and probably 70 to 80% of the work was telephone appointments. Now I would say 95% of my work is face to face, and that's that is that's got its own challenges in its own way. When you've got the patient in front of you and they have an agenda, they want multiple issues resolved. It can be quite difficult to close that consultation within the time frame allocated and have a happy patient leaving the consultation room. So I would say that's one challenge I'm experiencing at the moment. I enjoy the independence. I'm practicing independently. I I'm running my own consultations. It gives you a sense of empowerment. I'm um, make a management plan by myself, and then if it's out of my scope, I ask my supervisor for some help. But I definitely do enjoy the independence. Recently, we've had a new clinical pharmacist join our practice, and he asked me for some support with a baby, and he didn't know how to manage this baby. I believe the baby came in with a slight sort of viral illness or something similar to that. And so on that occasion, he asked for my support, and I believe that he received my support well. So he's asked me several times for some advice on different patients, and I think that comes to mind immediately. That would be one of the leadership roles that I'm taking at the moment. I'm supporting him and guiding him with management plans, and he comes to me if he's unsure about things. And I do actually, unless I'm completely overwhelmed with work, I do actually enjoy sort of almost having a leadership role, giving some kind of support and clinical guidance to someone, to a colleague, and teach them at the same time as well, because I do enjoy teaching. Um, a couple of days ago, the physiotherapist as well asked me for advice on a couple of patients. So, so that would be um, the leadership role that I'm taking at the moment. There's other clinicians within the practice who are, if there's something that they're concerned about, they ask me for a little bit of advice. So recently, I attended the Oxford Medical's Essentials of Medical Leadership course, and it was brilliant. We had an excellent speaker who was engaging, um, and interactive with everyone and had a great delivery style. Um, we were we were split into groups by our tables and had introductions with each other. There were there were doctors from all specialities. There were all different specialities and also all different grades as well. So we had from consultant down to, I think maybe there was an FY2 there, and there were a widespread of specialities going from anesthetics to ophthalmology. Our tutor taught us about different leadership models, and we explored those models through means of some adventure challenges. It was really engaging and interactive, and we worked together as teams. It was very enjoyable. And then we had discussions around that of how we could apply that in real life scenarios at work, and there were multiple examples around the room of senior registrars or consultants who obviously have a strong leadership role all the time, who were able to give examples and apply those models in practice. It gave me insight into the styles of leadership that I have strengths in, and also lots of areas for improvement. And moving forward, I can implement a lot of these areas, you know, areas of improvement, and use that in practice. So at the moment, I'm still in a junior role, so I'm a registrar, and uh, I enjoy almost supervising or guiding colleagues at work. Um, but moving forward, I may, once I'm a fully qualified GP, I may take up a supervising role or go into training and teaching, which I do enjoy. And that was one of the reasons I chose this course as well. One concern that a lot of trainees have about GP work is it can be quite isolating. You're working by yourself, you're working independently. That has its pros and cons. The other challenge for me is that I am the only trainee at my practice at the moment. So it's that extra bit isolating. But whereas the practice that I'm moving to in August, there's lots of trainees. They've got foundation year twos, they've got GP registrars, and I'm looking forward to be able to work in a bigger team. It's a much bigger practice, and uh, being able to talk to trainees during the day about our challenges. Well, I think that's what I'm looking forward to most.